Before administering an intramuscular injection, verify the patient's identity and medication order. Perform hand hygiene, prepare sterile equipment, inspect the medication, position the patient comfortably in the lateral or prone position, ensuring the gluteal muscles remain relaxed. Explain the procedure and obtain consent before continuing. Identify anatomical landmarks carefully. The ventrogluteal site is preferred in many clinical settings because it is distant from major nerves and blood vessels. Disinfect the injection site using a circular motion from the center outward. Allow the antiseptic to dry completely before injection. When indicated, use the Z-track technique by gently displacing the skin and subcutaneous tissue laterally. This helps reduce medication tracking into superficial tissue. Insert the needle swiftly and smoothly at a 90-degree angle until the appropriate depth is reached within the muscle. If required by your organization's policy or the medication's prescribing information, gently aspirate for 2 to 3 seconds, withdraw, and prepare at a different site. Administer the medication slowly and steadily. This promotes comfort and even distribution within the muscle. Withdraw the needle smoothly. Release the displaced tissue if using the Z-track technique. Apply gentle pressure with sterile gauze, avoid vigorous massage. Dispose of the needle immediately. Observe the patient for any immediate adverse reactions. Document the medication, dose, route, injection time, and patient response according to institutional policy.